Good morning, Queensland, and good morning to all of our Facebook Live followers. And it's wonderful to be here at South Bank, where we've got hundreds of people today due to get their vaccines, and whether it's boosters or vaccines for children, this is wonderful to see Queenslanders coming out and getting the vaccine. Of course, today is a very important day because that really important cohort of 5 to 11-year-olds start to get their vaccinations here. Around 800 will be done here today. That's basically the size of a mid-range school. So we're going to see a lot more vaccinations done, not just in our vaccination centres, but right across the state. Also too with the great work of our GPs and our pharmacists right throughout Queensland. So we've got a period of time now for our children to get vaccinated. It's excellent news that ATAGI approved this age group to happen. And I know that my nieces and nephew, they're looking very much forward to getting their vaccines as well. In fact, my little niece Lucy was the one who was always at me about when she could get her vaccine, and she's booked in for next week when she gets back from her holidays. So today in our COVID update, now the Health Minister will explain a little bit more, but we just haven't got some results in yet from our private pathology. So at the moment it's standing at 9,581 new cases, and 3,714 are included in that of positive rapid antigen tests. So Dr Gerard, our Chief Health Officer, will give you a bit more detail about the hospitalisations in the ICU. And at the moment there's 419 in hospital and 21 in ICU, but he'll go through those in a bit more detail with you. Over 21,000 tests in the last 24 hours, so that's great to see Queenslanders coming out and getting tested. And our vaccine coverage is slowly getting a little bit higher, 91.15% at least one dose, and 87.79% are fully vaccinated. Boosters, we're up to 709,133. And remember what the Chief Health Officer said yesterday, if you are due to get your booster, please make sure you come and get your booster. That is that extra layer of protection that you need, and it's really important that you book in and you get that done. Okay, so I just want to talk a little bit about the vaccinations for our 5 to 11-year-olds. So Queensland Health has 26,000 bookings in 2 weeks since the 27th of December. And there are approximately 478,000 children aged 5 to 11 who are eligible in Queensland. Now, we need to make sure that parents are booking their children in, but of course, it's all dependent on supply coming in from the federal government. And my understanding is that we'll get an update on that at National Cabinet this week. So the way you can book is you can log on to the Queensland Government website, the booking page, and as I said, vaccinations are available at Queensland Health Clinics, Commonwealth-run clinics, GPs, pharmacists, and Aboriginal and community-controlled health services. So I'll hand over to our Chief Health Officer, then the Health Minister, and then we'll give a weather update. Of course, that tropical cyclone up north is due to cross the coast, and I'll give an update about Maryborough as well. Thanks.
Thank you very much, Premier. So I will focus on hospitalisations this morning. As we've said previously, as time goes by, the number of detected and reported cases becomes less relevant and a poorer indicator of what's happening in the community, and hospitalisation becomes more relevant and interesting. And there are some interesting trends we're observing here. There are 21 patients in Queensland hospital intensive care units, of whom 7 are currently ventilated or ventilated as of 7 p.m. last night. And there are 419 cases in hospital requiring treatment for COVID-19. This latter number is steady. The intensive care number, overall, that's still a small number by Queensland standards. The overall hospitalisation rate, particularly the ward rate, is increasing steadily. And as I mentioned yesterday, we expect that rate to increase significantly in the next week or thereabouts. Sometime this week, we think that number will start to escalate significantly. A particularly interesting observation is that a substantial number of the cases are occurring on the Gold Coast. About half of the intensive care admissions, or just over half, 11 out of the 21, and about a quarter of the ward admissions, 101 out of 419, are currently on the Gold Coast, suggesting that there is a significant surge of the virus there on the Gold Coast. We've said from the beginning that this epidemic would not occur in an even spread at all at the same time across Queensland, and it looks like at the moment the surge is probably occurring on the Gold Coast. It's not surprising given the sheer number of interstate visitors which would have caused seeding events to have occurred, particularly in this area, because we know we have a lot of travellers going to that region. But I would also point out that the vaccination rates on the Gold Coast are among the low end, I think the lowest in southeast Queensland at least. So I would certainly encourage every Queenslander to get vaccinated, obviously. I would particularly encourage people to get those boosters. Those boosters are really critical as we go forward. And I can't overemphasise that. That's for those who've had their last dose of the vaccine more than 4 months ago. I was asked yesterday about vaccinations. I can get some specific in the hospital. I just got some specific interesting information from, say, the Gold Coast Intensive Care Unit, which has the 11 inpatients. Just remembering, so there are 21 inpatients across Queensland in intensive care units. 11 of them are in the Gold Coast. There are just 10 outside the Gold Coast in intensive care. But of those 11 in the intensive care unit, 6 are unvaccinated, and they have classical COVID pneumonia of the type we saw in the pre-vaccination era, which seems like a long time ago to me now, but that similar sort of clinical picture to what we saw in New York and in Rome and in Melbourne, all that long before vaccinations exist. And it's hard to believe, in my mind, how you could still be unvaccinated now in the middle of a pandemic. But yes, we have of those 11, 6 are unvaccinated. Of the five others, they were double vaccinated, but all had complex other medical issues that were mixed in with the cause for their intensive care admission. And when I say complex, I'm talking about 2 of them had head injuries plus COVID. One had a big stroke plus COVID. One had a major seizure disorder and a long-term brain injury plus COVID. So those were the vaccinated ones in intensive care unit. The ones with classical COVID, what I call old-fashioned COVID pneumonia, were all unvaccinated. And none of those patients had received boosters. It's also interesting as over the last few days, the proportion of Omicron is increasing. We're now sitting at around about 90%. It's completely dominating all other viruses here in Queensland. So what we're going to see in Queensland is which is quite unique, is an Omicron pandemic, and it will be interesting to see how that differs from what has been seen elsewhere. Omicron definitely can still cause severe disease. It's not trivial. The main reason why we're not seeing huge numbers of intensive care admissions, the main reason is because of our high vaccination rate. It's not because it's Omicron. Omicron can definitely put you into intensive care unit if you're not vaccinated. It is slightly milder than the Delta strain or the previous strain. We're looking after 27,087 patients in our COVID Care at Home program, and as of the 8th of January, vaccination coverage for the 16-plus group was 91.15% first dose, 87.79% second dose, and yesterday we gave 13,301 boosters through Queensland Health sites, so I'm very pleased with that. Thank you very much. I'll now hand you over to the Minister.
Well, thank you. As the Premier said, we are not able to give our full number of new cases overnight. There's 4 labs that have been unable to to give us all of their testing and their positive numbers. We believe this may be due to an update in software that has caused a glitch, so we're working through this, and as soon as we have updated data we will report that. But as the Premier has said, we can report that there's 5,867 PCR positive tests and 3,714 rapid antigen test results that we're aware of. I do want to say how great it is that we've got 4,713 5 to 11-year-olds who are getting their vaccinations today in our state clinics that are already booked in. Now, we know that parents are lining up for walk-ins and some have already managed to get in and get vaccinated. I do have to report here at the Brisbane Convention Exhibition Centre that they are having to stop the walk-ins for the rest of today because they already have 800 5 to 11-year-olds booked in, plus the other adult booster shots and other vaccinations that are booked in. So they are at capacity and they're working with the lines and people who are already here today to see if we can book them in as well. We have 30 vaccination clinics open today. 22 of those are offering vaccines to children, and we will be moving to 42 sites that are either fixed, outreach or pop-up clinics over the next few days that will be able to offer vaccinations for 5 to 11-year-olds. We know there's been a bit of confusion where some of the bookings have clicked the link which has led to 5 to 11-year-old vaccinations being reported as adult vaccination bookings for today, which is what we saw here at BCEC. We're identifying them very quickly, and that's why our numbers today have jumped from 500 to 800 bookings for children. We will seek to address that today and make it clearer so that families make sure they're booking for children and not adults when they are booking for slots. We handed out 16,000 rapid antigen tests yesterday at our testing clinics. So thank you to the people who are going to take those tests and do their testing at home. I remind people, if you are doing a test with a rapid antigen test in your home and you get a positive result, please make sure that you go online and you record that positive result or you phone up the 134 COVID number so that we know that you are positive and that we can support you, and it also helps with our modelling and planning for our numbers as well. The last thing I want to do is talk about our testing. We are seeing a fair bit of abuse happening at our testing clinics for people who are wanting rapid antigen tests and either are not eligible or our sites have run out, or they are not happy that they're only being given one kit. Now that kit will often contain 4 or 5 tests, but people are getting angry with our staff and volunteers because we're only handing out one kit per individual. Please respect there is a limited supply of these tests right now, and do not abuse our staff and our volunteers who are working on the front line to help people keep safe here in Queensland, and it's unfair to take your anger out on them. So please show respect, please show patience, whether you're lining up for a test, whether you are lining up for a vaccination, or you're coming into any one of our emergency departments and waiting for care. Please show respect and patience for our really hard-working frontline staff, and I do want to give a shout out to all of our hospitals and our paramedics at the moment who are doing an incredible job, and all those working at our testing and vaccination centres.
Good morning. Just quickly, thank you to Queensland for listening to the messages around masks. We did see an improvement yesterday, so 189 were handed out, so that's a reduction and only one on-the-spot fine. However, 168 of those masks are on the Gold Coast. So as you've heard from the Chief Health Officer, there are lower levels of vaccination and increased illness on the Gold Coast. So the message to all of our community, and particularly our people on the Gold Coast, please carry and use your mask. Thank you.
Yeah, we'll do questions now about health, and then I'll move on to the weather update.
Just on yesterday, obviously we've seen the comments from the Teachers Union that said that they were a bit blindsided by yesterday's decision. Did you consult them before making that decision about schools going back late?
Look, the Minister is in constant contact with the unions, and she'll continue to liaise with them.
There was some parents sort of saying yesterday, especially those that don't fall under that category of essential workers, that now have to take time off, unpaid leave to look after their kids. Is there any talk of a package that may be able to support families through that 2 weeks?
Look, we'll talk through those issues with families that need to work, but they would probably be classified in that essential category, and they would be able to have their children at school during that period of time. As I said very clearly yesterday, this is an unprecedented time. We don't want children to miss out on learning, which is why that extra week has been added, but we also want to make sure that our children get vaccinated. And as you can see, we've got over 400,000 between 5 and 11 to get vaccinated, and our peak of this virus is going to be during the last week of January and the first week of February. So we need to make sure that we are focusing on the health response. We get our Year 11 and 12s get their online learning, but I think this is a sensible, common sense approach that the government has taken. And can I thank the parents out there who have responded very favourably to what we have done, saying that they want to keep their kids safe as well. It's not just Queensland Health that are doing these vaccinations. The Commonwealth is in charge of the supply going out to the GPs and to the pharmacists. So in the vast majority of cases, the vaccines will be done through the GP and the pharmacy network. We are running our vaccination hubs to get as many children vaccinated as possible, but we're also doing boosters. And once again, can I please say to those people out there who are unvaccinated, please go and talk to your local GP. You've heard firsthand now from the Chief Health Officer about the consequences of what can happen if you catch Omicron, and you could end up in intensive care if you are unvaccinated.
How many kids does the government have the queue coming forward to February 7 during the vaccination program? It takes a while for the vaccine to kick in and work for effectiveness. Is that an argument for a staggered return for some children?
Well, no, I don't think so, because we're taking the health advice, which is not just from Dr. Gerard, but also from AHPPC and National Cabinet as well. So, we are going to be in the peak, which is why it's been delayed, which also gives an extra 2 weeks for parents to get their children vaccinated. They're private labs, so the health ministers are trying to get the updates from them. They're not public labs, they're private.
Do you know how many teachers are unvaccinated?
No, I don't, Jack. No.
Is there a way we can get that figure?
Look, I'm really encouraged with the number of people that are getting vaccinated, especially our frontline workers, which include police, which include our health, and include our teachers. So, look, it's really important. I think everybody knows I've always said this from day one. This is a world pandemic, and we are part of this world pandemic, and the best way to protect yourselves is to get vaccinated. And it's great to see people increasing the mask wearing. I've noticed that out and about, and it's wonderful to see everybody here today complying with the rules and wearing their mask, and I urge Queenslanders to continue to do that. We've just done a massive air conditioning upgrade to our schools. Well, how about we get the kids vaccinated first, and we'll be looking at all those other options, but it has not been raised with me as an area of concern.
How many kids does the government expect will actually be vaccinated by the time class review?
Well, let's try and get as many done as possible. There are going to be some parents who will choose not to have their children vaccinated. But I urge families, if you have any concerns whatsoever, to please talk to your GP or come into one of our vaccination clinics and talk to our professionals here. It is safe, it is effective, and children are getting vaccinated around the world.
What would you say to those parents who are concerned about their children sharing a classroom with unvaccinated children?
I don't think there needs to be any concern because, the more people that get vaccinated, the better. That's the way we are in society at the moment. So I'm just urging parents to go and talk to a professional, and please, I'm encouraging you to get your children vaccinated.
Is there an update on the QVCC and newly appointed commissioner?
No, I haven't got an update on that yet.
There's been no discussion on it at
There's been discussions, but I haven't got an update yet. Look, I think the issue here is, and look, can I say, and I've spent a couple of days down the coast in the past as well. There's a lot of people who are coming in from other states, and Queenslanders have always done the right thing and been wearing masks. But unfortunately, I think when people feel like they're on holidays, they think they don't have to comply with those protective measures. And the last thing I want people to do is to end up catching COVID and going back to the state that they've come from, which was supposed to be a holiday. What we are seeing though, and it is a fact, that unfortunately in the southeast area, the Gold Coast is just under the state average. It's not far behind, but really for a tourist destination, I would have loved to have seen the Gold Coast at around 95%, which is what we're seeing in the inner Brisbane area. Even Cairns is now up to, I think, 92.6%, and we'll get updated figures later on today as well. So what I'm encouraging people on the Gold Coast to do is, if you are unvaccinated, to please go and get vaccinated. And as you've heard, the surge does seem to be happening on the Gold Coast at the moment. I'm concerned about that, and so I'm urging people, if you are not vaccinated yet, to please go and get vaccinated. And if you're indoors, make sure you're wearing the mask, and if you're going into a cafe or a restaurant, wear your mask, and please ensure that the staff are wearing masks as well.
I mean, what do you put it down to? Is it the southern end's proximity to New South Wales Northern Rivers, which also has a low tax rate? What do you put that down to? It is a major metropolitan area in its own right. It seems surprising.
Look, we've been down there a lot encouraging people to get vaccinated. It's different pockets around the Gold Coast. By and large, I think people living along the coastal communities have got vaccinated. The elderly have been vaccinated. But there are some pockets that aren't. So look, can I just please encourage people on the Gold Coast, please go and get vaccinated. You are a tourist destination. A lot of people are coming into the Gold Coast, and if you are elderly, if you're that vulnerable cohort, please think about, for the next 4 weeks, maybe limiting your movements until you get that booster.
Is there any new modelling on when we'll hit that 90% double dose rate across the state?
Not at the moment, no.
Premier, if you get to the 7th of February and you're not content with the numbers, would you look at perhaps extending that holiday period again by another week?
And my aim, look, let me say, my plan is to get children back to school on that 7th of February. That is clearly my aim, because it's very important that children get their learning experiences. I don't want them to lose any more time. So that is the plan, and that's the plan we're working towards.
You've indicated, Premier, when you see that, that's exactly what parents are calling for in New South Wales, a delay. They're very reluctant to send their kids back on schedule. Does that give you a certain amount of...
Well, that's a matter for New South Wales, but that depends on, they will have information about when their peak is. My advice is that the peak is going to be that last week of January, first week of February, and I think you would see during that time that parents would not have sent their children to school. We would have had staffing down as well. So let's deal with the health emergency. Let's get everything prepared for our start of the school year on the 7th. Let's get our children vaccinated so parents feel safe and confident, and children feel safe and confident. And then we start the school year on the 7th of February. But of course, those year 11s and 12s start on the 31st. Yep. Okay. And then we'll do weather. Okay. Thanks.
No, I think it's purely a software upgrade problem. I would read nothing into it, and I'm sure we'll get the data soon. I would read nothing into it. Not at this stage. I've been in close communication with them. There's pressure on them, but we actually expect more patients. So they're prepared for more patients than just 101. So they've been planning this for a long time. So no, not at this stage. Yep. I'm sure they are, but they're prepared. They're ready for this, and I can say they're prepared. That is that agreed? That's still under discussion, I believe. There's been some discussion in the AHPPC on all of these issues, and it still hasn't been fully finalised. If I can just say something about this, I think parents shouldn't be overly anxious about this virus. I mean, I worry that we are making parents very anxious that it's going to make their children terribly ill. For the most part, the children will have only a mild illness very similar to any of the respiratory infections they've had in the past. There definitely are rare complications of COVID in children. I'm not going to downplay it, but for the vast, vast majority, it is a simple respiratory virus like a virus they would have had in the past. It's very likely that there will be a surge in infections when schools return. We know that. Any parent knows that when schools return from holidays, there is a surge in virus cases, and it is inevitable that will happen when schools return. In reality, the biggest risk is not to the children themselves, it's to the people around them, to their parents and their grandparents. So as much as anything else, this 2 extra weeks gives an opportunity to others who might be at risk to get that 3rd dose. That's what if I'm pushing anything, it's that in particular. Children also certainly, we know vaccinating the children will protect them. Even just the 1 dose will offer some protection. We know it's important that the parents of the children also get vaccinated because we know they're often the source of infection, and that the parents get boosted. So I guess trying to get this as a balanced message, parents shouldn't be too anxious about this virus. I don't want them to get too anxious about it because in the most part it's a mild illness in children. The complications which do occur, they do occur with influenza, are rare. But because it's likely that there will be a very substantial number of children who will get the virus, even if they're vaccinated, that's likely, then we will see those complications in the coming weeks. Not unduly. I don't think we've seen a bit. There's seen a bit of something called bronchiolitis in small children. I've not heard of a specific problem with asthma. Specifically, no.
Dr. Gerard, we were talking about the hospital numbers that you're predicting that obviously that's going to go up pretty significantly. We're seeing sort of 20, 30 a day.
Yep.
Do you predict that just one day it's just going to double, or do you think it'll be
It looks like, well, our projections suggest that something significant will start to happen in the next 7 days, and it will be apparent. Now, the projections might be wrong. They might be wrong. And, we've got quite a substantial number of people. I think it's something like 45% of Queenslanders who are eligible for the booster dose have had the booster dose. So that may make a big difference. I really must emphasise also that we're seeing in the ward area, that intermediate moderate severity illness where people are admitted to the ward for a brief time requiring oxygen, a significant number of those have only had 2 doses of the vaccine. Okay? So that does happen. So it doesn't give you 100% protection against moderate illness. It gives you significant protection, but not 100% protection. If it didn't give us any protection at all, our hospitals would be well and truly overrun.
What are the projections that show that the peak of hospitalisation?
First week of February is what we're currently predicting.
What number? What time? How many?
Yeah. Oh, we're getting pretty close. We're getting pretty close to that 90%. It's not that far away, and then we'll review all. Then we're going to change all of our. Everything changes after when we reach 90%.
The Prime Minister suggested today that the delay would push back the Omicron wave. Will it delay the Omicron wave?
Well, sorry?
The Prime Minister suggested today that the delay of school returning in Queensland could push back the Omicron wave. Will it push back the wave in your opinion?
I don't know that I understand what he's saying. I didn't hear what I didn't hear what he said.
We'll move on to weather.
Okay, thank you.
Okay, thank you. We've got a few things to get through, thanks. So I thank the health people, and we've got the State Disaster Coordinator. So a couple of things. So the first thing is Tropical Cyclone Tiffany is, my advice is currently a Category 2 system and is due to hit landfall early this afternoon, west of Cape Melville, north of Cooktown. There could be gusts of up to 110 kilometres per hour. Will develop between Cape Tribulation and Cowan, including Cooktown. And there'll be heavy rainfall in the area, of course, today and tomorrow, and there could be widespread totals in that area. So my understanding is that all the communities are well prepared and they have been through this before, so they absolutely know what they are doing. But of course, everyone should follow and listen to the emergency alerts that come out from the Bureau of Meteorology. I'll hand over to the State Disaster Coordinator, but in relation to the flooding in Maryborough, and can I thank all of the residents in Maryborough. The council's been doing a great work as well, but also in those surrounding communities, this unprecedented weather event. So the peak was around 10 metres last night. It's starting to come down now, which is great. My understanding was that one of the underground valves of the levee was damaged, which meant some of the inundation happened in the CBD. And also it's great to see that those disaster relief payments have been activated by the Commonwealth this morning. That's going to be very well received by the residents. It's going to be a tough few days and weeks cleaning up after this as well. There's been a bit of structural damage. We've got rapid assessments that will be done during the course of the day, and we'll be able to update everyone tomorrow. So I'll hand over to the State Disaster Coordinator. Thanks, Steve.
Thanks, Premier. As the Premier just stated, we've just seen an updated advice from the Bureau of Meteorology at 11:14 a.m, which indicates a similar track and that the cyclone will remain at Category 2 as it crosses the coast. Our preparations are very good. We have high confidence in the shelters and the structures in the areas that will be impacted. Even though they are small communities, they are important ones, so we have high confidence there. We have factored into our planning the cases that are of COVID that are currently in the Cape, and that is well covered in our operational planning. And similarly for the emergency response that may need to come afterwards if we have loss of power and the like, we have testing of those people in place before they go in. So all of that is looking pretty good at this stage, and we expect the cyclone to cross this afternoon, so we'll stay across that obviously. With respect to Maryborough, as you've heard from the Premier, it has peaked. It did peak last night. The river was currently at 9.06 metres and falling, and is expected to go below the major flood level of 9 metres this afternoon. That will allow us to increase our assessments of the area, but because of the lower peak, we were seeing less people impacted, less businesses. It was around 30 structures that were impacted in the CBD, and we had 35 persons, including 4 from the CBD, that were in the evacuation centre in Maryborough overnight. The search and rescue for the missing 14-year-old continues. This is going to take some time. We are taking this extremely seriously. Whilst we have very grave concerns, we are hopeful. We saw yesterday a pair of people came out after an extended period in a tree, and those people had not been reported missing, and they were able to be supported when they came out after what was probably a pretty terrible experience for them, but they are safe, so that was a very good outcome. We have no other missing persons reported at this stage, so we'll continue to work through that. We have seen some short-term impacts on supply, but that's improving as the Bruce Highway has opened. But can I just advise everyone travelling in that area, the Bruce Highway, whilst it's open, is impacted. There is repair, there is delays, and can everyone that's going to travel in that area please go online to Queensland Traffic, that's QLD Traffic, for updates around what's happening with roads in those spaces. We have seen rail suspended in that area between Gympie and Maryborough too, waiting train tracks. So as the Premier said, our rapid assessments of damage in that area will continue for the coming days, and we'll have a more detailed undertaking of explanation of what's happening tomorrow. Thank you.
Any questions there? No? All good? No, we finished that. Okay, thanks.